So we're going to talk about neuro-ophthalmology and CIDP. CIDP stands for chronic versus acute, inflammatory, demyelinating polyneuropathy. So that is CIDP. It's a polyneuropathy because it affects many nerves. It's demyelinating because it's taking off the myelin. It's inflammatory and it's chronic. In the acute form, AIDP, this presents as an ascending polyneuropathy with areflexia, and the patients have albuminocytologic dissociation. That is, they have a high CSF protein but a normal or near normal cell white count, and it can present with ophthalmoplegia. And the name that we give to this condition, AIDP, is Guillain-Barré syndrome. And when you have the ophthalmoplegia, we call that the Miller-Fisher variant of Guillain-Barré syndrome. And AIDP, Guillain-Barré syndrome, sometimes has optic neuritis. And therefore, it doesn't have to just be peripheral, it can be central nervous system too. So now you can see how this comes to us in neuro-ophthalmology. In patients who have acute onset of an ascending polyneuropathy, areflexia, albuminocytologic dissociation, you're going to be thinking about the Guillain-Barré syndrome. If they've got ophthalmoplegia, we're going to be thinking about the Miller-Fisher variant of Guillain-Barré syndrome, and that can be associated with optic neuritis. And just like AIDP, CIDP can be associated with optic neuritis and ophthalmoplegia. However, CIDP, unlike AIDP, has no eponym, so we just call it CIDP, and the ophthalmoplegia of CIDP has no eponym, so we just call it ophthalmoplegia in CIDP. So you need to know both the acute and chronic forms of inflammatory demyelinating polyneuropathy, characterized by an ascending polyneuropathy, albuminocytologic dissociation, and the inflammatory antibodies that are associated with these are anti-ganglioside antibodies. For example, anti-GQ1B or anti-ganglioside, but there are all these different ganglioside antibodies. And it can be chronic, which can be associated with afferent disease in neuro-ophthalmology, optic neuritis, or efferent disease, ophthalmoplegia. And as opposed to the AIDP, CIDP has no eponym.